Thought I lost my chapstick. I was really about to cuss some people out in this house over it, and by people I mean these two cats. But we found it. Welcome back to Social Work Exam Prep. So I have been playing around with this idea for a little bit, and I decided let's start it today. So today we're going to start the series that I had mentioned before on Psychopharm 101. The first set of videos we're actually going to be doing on antidepressants. So I'll go over each of the different subclasses within antidepressants, probably going to focus on some of the major ones initially, so that way you guys have that information and all that's good to know about it. And I'll go over overall what's helpful for the exam, but also real world stuff, because we all know that sometimes what happens in the real world is not the textbook version of things. So I want to make sure you know not only what's going to be on the test, but also what's good in the real world. In the caption, I'll list all the different medications, but I may not list them in each video. So just an FYI in case you're looking for that. I also have a med sheet that I created that I send out to people to help with making flashcards if you would like to print it out and use it in that sense. So I have that as I have that as well. This is meant to help you with prepping for your ASWB clinical exam. I have noticed this pretty often, and I wish that it was gone over during our MSW programs a little bit more / at all. And I see this with a lot of my social work residents over the years of doing clinical supervision, that one of the bigger areas that they struggle in is oftentimes medications and even to some extent diagnostics, if they're not in a formally heavily clinical setting, in the context of they are just in private practice or just in an outpatient clinic, where they might come across a myriad of different things and not necessarily be able to hone in on a lot of any particular thing. Anywho, so I would like to be able to give back, because I feel like when I'm working with any of my social work supervisees, this is something that we go over a lot, and I've seen it. So I figured it might be a need out there in the world as well. And so I want to give back a little support. I hope that this helps. And if it does, let me know in the comments. Like I said, this is going to be a series of videos. So here we go with antidepressants. The subgroup of medications within an antidepressant that we're going to go over are SSRIs. So what are SSRIs? The acronym stands for Selective Serotonin Reuptake Inhibitor. It's a commonly prescribed antidepressant, generally also first-line medication for treatment, and oftentimes it's used for depression and anxiety in the real world. But just remember that for the sake of the test, it falls under the category of an antidepressant. I don't want that to necessarily throw you off if one medication is used in one way in the real world, but it's not that category, so just keep that in mind. These medications don't generally have a lot of side effects, but your patients or clients can sometimes experience them, so it's really good to know what those side effects are to be able to kind of track if somebody says, hey, I started this new medication and I'm feeling these things. It's good to know if that's a side effect that's traditionally associated with that medication, or if it sounds like it could be something else. Just gives you something to point them in the direction of, in terms of saying, talk to your doctor about that. It does, or it does not sound like X medication might be causing it, but there's a chance, so bring it up with your provider. At any rate, you want to make sure that if you are providing education, that you know what some of these things are. So we will go over the side effects that are common with these medications as well. But the medication can take 4 to 6 weeks to become therapeutic and maybe for them to notice anything. Now, that doesn't mean that somebody doesn't feel something, 3 days in. But generally speaking, we say give it about 4 to 6 weeks. So that helps you to kind of advise your clients or patients if it turns out they're a week in and they're like, it's not working, I don't feel any different. And you can kind of go over that to say, it does take some time. Why don't we wait until we get to X point before you decide to kind of give up on it? Also, most outpatient prescribing providers are going to want to wait the 4 weeks, and they usually have them schedule a follow-up within a month or 4 weeks from the time that they prescribe the medication, so that they can check in and say, how are things going? And decide if the dose needs to be titrated up, or if the dose needs to be titrated down, or if it should stay where it's at. So usually it's about a month with these medications. So if somebody feels a little hasty, tell them to chill all the way out. I guess that's what the medication is supposed to help them do. So what's the mechanism of an SSRI? Basically, The SSRI is a medication that is affecting serotonin. Serotonin is a neurotransmitter that's found in your brain, and it's one of many. Think about it in the context of someone delivering a package, right? There's UPS, there's FedEx, there's the post office, there's DHL, even Amazon, right? So pick any one of those and make them the neurotransmitter serotonin, and then the rest of them can be any of the other neurotransmitters. But the idea is they as neurotransmitters deliver messages to the cells in your brain, which are called neurons. And basically serotonin is one of those that delivers messages to your neuron. After it delivers the message to its desired location in your brain, the serotonin is taken back into the neurons, aka what is considered reuptake. By blocking the reuptake via the SSRI, the selective serotonin reuptake inhibitor, it allows for serotonin to basically continue to do its job. So instead of the snowstorm being what blocks the post office from delivering your package, it allows it to do its job. Somebody plows the snow out of the way and the post office is able to make your delivery. Or FedEx, Amazon, UPS, DHL, whoever you prefer to deliver your packages. Think of it in that context. The SSRI was the snowplow. The blizzard that fell was the thing that was trying to block the job of the serotonin from being able to continue. Snowplow was the SSRI drug, moved all of the snow out of the way, and the neurotransmitter was able to deliver its message to its intended destination. And yes, I did use blizzard because I was on the side of the country where we got 1 billion feet of snow. Side effects. So, when it comes to an SSRI, there are some very common side effects that could come up. Now, what I will say is oftentimes, from what I've heard from patients, the side effects are either non-existent, very minor, or they pass very quickly to the point where they're only uncomfortable for a short period of time and then they're fine. But at any rate, upset stomach, so to some extent nausea. I don't know that I've ever heard of anybody actually vomiting. Usually it's just the nausea, sweating, headaches, heavy sleeping, or fatigue or insomnia. Again, I don't see that too often. I think I've seen that in a few patients where they have like severe issues with sleep management that have developed after they take an SSRI, but it's not very often. Dry mouth, I have seen this, and oftentimes I'm telling patients to make sure that they're getting enough water anyway, so this sometimes helps with the dry mouth, but if it does get to be excessive, where even when you're drinking plenty of water, it's a problem, I usually say speak to your dentist about it, because if there's dry mouth, it could be something else going on, and they might be able to recommend options for how to treat that. In terms of the upset stomach, I know that providers oftentimes tell patients to take their SSRI with food so that helps to alleviate any issues of nausea if you're taking it on an empty stomach, especially if you take it on an empty stomach with water versus like an empty stomach with something with some carb or some kind of sugar in it that can kind of help support it. Nervousness, have seen that, shakiness, sexual dysfunction. That is something that I have seen, and I'm not saying it's common, nor am I saying that it's extreme, but I have seen it in some patients, and so sometimes they have to test run a few different SSRIs to find the one that doesn't cause that. And that is very common for people to test run a couple different, because each SSRI affects your brain and the way the neurotransmitters are managed differently. So just because your friend said that one worked for her and it doesn't work for you, that doesn't mean none of them will work for you. They all affect the biochemistry in your brain a little differently, and so that's why sometimes it can take some trial and error. Make sure you let your patients know that, your clients know that, so that way they don't feel so defeated if the first one doesn't work. It can be a bit of a try this, try that type scenario until you find the right fit. The other thing I've seen is changes in appetite. Usually kind of a lessening of appetite, but sometimes people do eat a little bit more. It is something to just keep in mind, where if the patient or client recognizes that you're able to kind of address it with them. All right, so some of the well-known SSRIs that I'm sure some of you have heard of are Sertraline or Zoloft, Fluoxetine or Paxil, Escitalopram or Lexapro, or even Citalopram and Celexa. So I just gave the generic brand name and then the brand name of the medication. These are not by far necessarily the entire list per se, but just some of the ones that are more widely used or that you may have heard of from your patients. Sometimes the patients will only know one version of the drug name, so it's good for you to know both. So this way you're not surprised when someone says fluoxetine. If all you've ever heard is Prozac, you should know both as much as possible. And even if it's just you write down the name of the drug and you double check it later, have a reference somewhere, sticky note, anything like that. But make sure you do know both, because oftentimes I have seen that patients know one name or the other. Very rarely do I see it where they know both, because they usually are just reading what's on the bottle. Well, that's it on today's mini series. No, I don't know. Today's video on SSRIs. If you have any other questions or anything like that, leave them in the comments. I'll do my best to answer the comments, or if there is such a great need, I'll make another video. But I will be doing the next set of antidepressants as my next video to continue the Psychopharm 101 series as we go through all of the different medications. I do have the med sheet, so if you would like the med sheet to be able to make them into your own flashcards, please let me know and DM me your email address so that I'm able to send it to you. It is okay, by the way, to educate on general information to your patients or clients, right? What the side effects could be, the 4 to 6 week kind of waiting period, and that it's an antidepressant and some of the things that it's been commonly treat. And then after that, I would definitely refer them to either a psychiatric prescribing provider, whether that be a psychiatrist, a psychiatric nurse practitioner, or a psych physician associate, or their primary care provider. Either of those are going to be able to help them. And oftentimes, most primary care providers, family medicine, internal medicine providers are comfortable with managing SSRIs in terms of mental health. I don't know of too many who are like, nope, we're not doing it. And for any of your patients who are pregnant or trying to become pregnant, make sure that they're talking to their OBGYNs, because oftentimes their OBGYNs or even their midwives are managing these types of antidepressants to help with depression during pregnancy. And so that's another place that can be a resource for women in that context. Happy studying. Good luck.